The new rules for international travelers headed to the U.S. go into effect on Monday. All international travelers will be required to test negative for COVID-19 within 1 day of departure. This includes both vaccinated and unvaccinated people. President Biden announced the new rule last week in response to the spread of the Omicron variant. But as CBS News national correspondent Mark Strassman tells us, an older strain of the coronavirus is causing the current spike of new cases across this country.
In COVID America, Omicron's the Greek letter that means, here we go again.
Oh, God.
Northwest Philly.
No. Are you serious?
A new variant, a new call to arms, to put shots in them.
We're actively taking steps to stay ahead of Omicron.
We'd better. Omicron's a shadowy threat. Still unclear whether this highly mutated variant's the most contagious yet. And consider a different worry. Omicron hysteria. It's a potential distraction from New York.
We have a much bigger current challenge with the Delta variant.
To Washington State.
It would be really sad if people lose their lives today because they've been killed by the Delta variant while they're worrying about Omicron.
Delta is dominating the U.S. now. 99.9% of this country's current caseload. In 47 states, cases trend up. Roughly 76% of U.S. counties considered high transmission areas. Hotspots? Iowa. Wednesday saw a 2021 record for COVID patients hospitalized. 3 in 4 of them unvaccinated. Massachusetts, averaging more than 3,000 new cases a day for the first time since January. And Michigan, COVID hospitalizations almost doubled in 1 week. A possible storm of community spread because of Thanksgiving. All those travelers and family get-togethers with COVID uninvited but present. It'll be a week, maybe 2, before data starts quantifying the infection impact. Also ahead, our second COVID Christmas. What do scientists want?
The answer is vaccines, vaccines, and vaccines.
Roughly 70% of Americans have had at least one shot. Only about 24%, age 18 and up, have had boosters. Waning protection is a genuine worry. Even fully vaccinated people can become spreaders after 4 months. Omicron has created one surge already in vaccinations. 2.2 million shots given last Thursday, including more than 1 million boosters. That's the highest single-day total since May.
If you are fully vaccinated before June, it's time for you to go get your booster.
Omicron has prompted another travel change, this one starting at midnight tonight. International arrivals have to pass a pre-departure COVID test. The window used to be 3 days, now it's 1. And that's regardless of nationality or vaccination status. Lana?
Mark, thank you. Joining us now to digest all of this is Dr. Esther Choo. She is a professor of emergency medicine at the Oregon Health and Science University. Dr. Choo, great to have you here. There's a lot for us to try and suss out, but let's just start with the basics. How is the Omicron variant different from other strains of the coronavirus?
It's great to be with you, Lana. The Omicron variant is notable because it has numerous mutations on the spike protein. That spike protein, of course, is what enables the virus to attach to our cells and infect them. And it also is the target for our vaccines. They stimulate antibodies against the spike protein. The Omicron has about 30 mutations on that spike protein. That compares to Delta, which had about 9 mutations on that spike protein. So that is what has really fueled a lot of the concern about its transmissibility.
All right, and preliminary reports are that it's about 2 or 2.5 times more infectious, but we still don't know a lot of things, one of which is how effective current vaccines are against this variant. Tell us about that process, how scientists try and figure that out, and what is the latest data and the latest that science is telling us?
Yeah, there's really 3 questions. One, is it more transmissible? Does it pass more quickly? Does it evade our immune protections, including immune protections conferred by vaccines? And then does it make people more sick? Does it have higher pathogenicity? And so we actually don't have good answers to all of these simply because everything is so new. So we know we're seeing this variant emerge, but we see lots of variants emerge from time to time. We don't know how its transmissibility really competes against other variants, including the dominant variant here, which is still Delta by far. And we just haven't had time to see how it performs in people who have been vaccinated and who have not been vaccinated, people who have been sick with coronavirus before and who have not. And that data simply takes time, and certainly takes even more time to see if it's making people sicker, leading to more hospitalizations and deaths. So some of it will be observation in the natural world. A lot of it will be scientists working really hard in laboratories, exposing replicants of the Omicron variant to blood from patients who have had COVID before or have been vaccinated, and seeing how that antibody response performs against the virus in a laboratory setting. So there are a lot of experimental things going on right now. I know scientists are working around the clock, and we will get some of those laboratory results probably first, and then we will see more real-world data around the world and be able to answer some of these questions in the coming weeks.
I want to ask you a follow-up about that because it's helpful to have a little bit of a time frame, and we understand that it'll take a couple of weeks, both as scientists are looking through this in a laboratory setting and as scientists are looking at the real-world population and the places where Omicron has really been able to spread. There's a question particularly about vaccines, and I understand that many of the vaccine manufacturers are already starting to try and create new formulations that could potentially better prevent against Omicron. How long would it take from right now before a new shot, if that is something that's necessary, and we don't know that yet, would actually be available to Americans?
Now, this is one of the wonderful things about what has happened with science over the past 2 years since COVID first emerged. We are so ready. Scientists I've talked to said you could potentially get a new vaccine that is targeted against a specific variant along the order of 3 or 4 months. Of course, it has to go through a regulatory process and a manufacturing process, but the science can move very fast. So apparently that work is happening already, but there is also a high likelihood that our current vaccines will still do a good job against Omicron, particularly once people are boosted.
And let's talk about travel, because beginning tomorrow, everyone traveling to the U.S. from an international destination will need to test negative for COVID within 1 day of departure, regardless of vaccination status. What's the advantage of being tested 24 hours in advance rather than 48 or 72 hours?
Yeah, the closer we get to the time of travel, the more likely we will capture people who are newly infected. And so, it tightens up the filters that we have trying to capture disease that is entering the country. Of course, it's impossible to maintain travel and have 100% filter, but bringing the timeline a little bit closer, giving people a little bit less time between their last test and their actual travel for infection to develop, obviously will make it more safer. It provides a lot more peace of mind for people who are on the airplane themselves. And I think it will give us a better chance to figure out what's going on with COVID spreading from country to country.
I need to ask you a quick follow-up on that, because I wonder, do we think that all international travelers will be able to get tested and get results back within 1 day? And does this mean a greater reliance on rapid tests, which tend to be less reliable than PCR tests?
Well, first of all, this is a huge problem. It's a huge problem. Test accessibility. Rapid test accessibility remains a huge problem around the world. It remains a huge problem here in the United States. I mean, right now, I don't know if you've had any luck where you are, but I still struggle to go to my local pharmacy and have rapid tests that are available, and they are far too expensive. I mean, a kit that costs somewhere between $14 and $26. That's the range I've been paying for them for a kit that has 2 tests inside of it. That is absurdly expensive. I often have to go to 4 pharmacies before I find them or order way ahead of time. So this is not somewhere in the world. It's a problem. It's everywhere. It's a big problem, including in the United States. And so this is something that airlines will need to help figure out. Governments will need to help figure out, and we will all, if we're imposing this, we all have a stake in improving accessibility of rapid tests, including their affordability. So yes, absolutely, that needs to be addressed right away. Otherwise, it's an effective ban. I do think that that we are trying to be. I mean, the fact that it's one day and not a specific number of hours. I know they're trying to make it as feasible as possible for people, in addition to really trying to layer on protections.
All right, Dr. Esther Choo. There are a lot of questions that you really appreciate you coming on and giving us your the wisdom that you can share, and also appreciate all that you do.
Thank you, Lana. Thanks so much for having me on.